The family of an infant that died at birth at Victoria General Hospital last week may soon get the answers they are looking for. Since August the 9th, the day the baby was delivered, the family has been asking many questions about how and why the newborn died and what, if anything, could have been done differently for a different result. VIHA and the coroner say the baby was stillborn, but the family disputes that claim. And now the Vancouver Island Health Authority will commission an independent external review and release the findings to the public. A News reporter Astrid Brownschmidt has the latest.
Shirley Anderson, seen here wearing the hospital gown, and her grandmother, Erna Turry, say they want answers and a full investigation into why Shirley's baby girl died during delivery on August 9th.
I held the baby and I made her a promise that I was going to find out. I'm going to get to the bottom of this.
They may soon get the answers they're looking for. The Vancouver Island Health Authority will commission a third-party independent external review into the case.
Where you've got serious issues around public concern raised, as in this case, we have to bring in an external review simply because we can't release our own.
Erna came to A News this week with concerns about the way she says doctors handled the birth of her great-granddaughter. She says she was with Shirley during her entire birthing event and says Shirley's baby showed signs of distress for 4 hours before the doctor decided to perform a cesarean.
I asked the doctor at that time, why didn't they give her a cesarean when the first red flag went up? She said because she didn't have an anesthesiologist.
Erna says it took half an hour for the anesthesiologist to arrive. VIHA says it has completed an internal review in which medical records indicate a much different time frame.
From the decision being taken to the anesthetic being started was 10 minutes, and then it took 16 or 17 minutes to complete getting this lady under the anesthetic so that the surgeon could start.
In a statement to A News, Regional Coroner Matt Brown says, "We are satisfied in the discussion we had with the attending physician in this case. There was no live birth. This is a stillbirth. When there is no live birth, there is no jurisdiction for the coroner." The number of stillbirths at Victoria General Hospital has dropped in recent years. In 2010-2011, there were nearly 3,100 births. 16 babies were stillborn. In the previous year, there were more than 3,000 births and 47 were stillborn. Erna insists her granddaughter's baby girl was not a sad statistic and believes the baby would be alive today if the C-section had been performed hours earlier.
And that baby was still alive because I watched its heartbeat on the monitor. We heard it, we seen it, she felt it. That baby was still alive when it went into OR.
The Vancouver Island Health Authority says the external review will look at all factors, including what link, if any, there is between anesthesiologist staffing levels on August 9th and the death of Shirley's daughter, Ava Marie.
Astrid joins us now live with more. Astrid, how soon could this independent review be completed?
Well, Hudson, the Vancouver Island Health Authority hopes that the review will be complete by early next month. And once those results have been shared with the family, they will be released publicly. The last time the Vancouver Island Health Authority commissioned an independent review was in 2006 after the death of George Cook. He was an elderly patient who died in the emergency room at Nanaimo Regional General Hospital after spending hours unattended on a stretcher in a triage area.
All right, Astrid Brownschmidt reporting. Astrid, thank you.
You're welcome.